Good afternoon, everyone. I am Ritu Verma. I'm a professor of pediatrics and the medical director of the University of Chicago Celiac Disease Center. I've been involved in the celiac disease world more in the clinical space for almost 20 years. And initially it was at the Children's Hospital in Philadelphia as the founder of the Celiac Disease Center there, and now here in Chicago as the medical director of the University of Chicago Celiac Disease Center. I'm also the SSCD liaison for advocacy with the CDF. So the SSCD is a society that's for the study of celiac disease. I'm sure all of you or most of you have heard of different societies for different diseases. And this happens to be the society that is for the study of celiac disease. And as you can see on the slide, the mission is to really advance the fields of celiac disease and gluten-related disorders by actually fostering research and promoting excellence in clinical care. And this is really the mission of the SSCD, and the membership is made up of physicians, dietitians, researchers, trainees, and an excellent organization to become a member of. And I am their liaison for advocacy with the CDF. And everyone knows about the Celiac Disease Foundation. So just to tell you a little bit about myself, I have been a clinician in the United States for 30 years. And initially, my mission really was to take care of patients and the patient's well-being. And I've watched the patients with celiac disease go through the struggles, the trials and tribulations of having to live in this world, which is filled with gluten. And at that time, my only sort of advocacy for the patients was working with them, till I actually attended the NIH conference, the Consensus Conference in 2004. And that's where I met other advocacy groups and learned that there was another way to really help my patients become an advocate. And since then, I have found so much pleasure in working with foundations like the CDF and learning from them, learning from Marilyn, how to become an advocate. As a physician, I know how to manage the clinical care of the patients, but not so much how to advocate for them on a national level. And this has been very, very rewarding for me. So today, the first thing that I am going to talk about and bring to your attention is the Gluten in Medicine Act of 2019. So currently, the drug manufacturers are not required to label the presence of gluten in prescription medications. Can you just imagine that if the anxiety that patients would have if they did not know that the medicine that they're taking has gluten or no gluten? As all of you will know, that if you are a patient with celiac disease, you've been educated, you've been taught, you've learned, it's been ingrained in your brain that you cannot put anything in your mouth that has gluten in it. Think about a parent who has a child with fever. And this happened to me several years ago. One of my patients, her child had a fever. She went to the emergency room, was prescribed an antibiotic. She went to the pharmacy to pick up the antibiotic, her child in a lot of pain, discomfort, and fever. Unfortunately, no one could tell her if that antibiotic was gluten-free or not. Did it have gluten or not? So just imagine the stress and anxiety that a parent is going through, where the medication is in their hand, but they're not comfortable giving it because it does not say on it, and no one can tell them, is there gluten or not in there? So this Gluten in Medicine Disclosure Act will make it so much easier. The stress, the anxiety would go away. It would make it safe for the families to really be able to go to a pharmacy and pick up a medication. 3 million Americans are living with celiac disease. 3 million Americans worry each day if they have to take a prescription medication. Wouldn't it be nice if we could all have this Medicine Act of 2019 be passed? Would make life so much easier for all of us. So my next point of discussion is the Medical Nutrition Therapy Act of 2020. So all of us who have celiac disease know that currently the only treatment for celiac disease is the gluten-free diet. Unfortunately, at this time, the medical benefits do not cover the cost of the visits to the nutrition expert, who really is prescribing the medication. So we cannot write a prescription and say, go see a dietitian and that it will be covered. However, for other diseases like Crohn's disease, multiple sclerosis, we can write a prescription for the medications. So at this time, we know that Medicare only covers outpatient medical nutrition therapy for patients with diabetes or kidney disease, and so leaves many, many seniors without care for celiac disease. The Medical Nutrition Therapy Act of 2020 would give Medicare beneficiaries access to the care that they need to provide coverage for people with celiac disease. Wouldn't that be wonderful to have that anyone, a nurse practitioner, a physician assistant, clinical nurse specialist, psychologist could refer their patients so that they would be able to see a registered dietitian or a nutritional professional who is really the expert to manage the gluten-free diet. We do know that the dietitian is really making an impact in the management of celiac disease. Besides teaching all of us about the gluten-free diet and managing the diet and managing the patient when they're being diagnosed, they're also very important for follow-up. So we do know that celiac disease affects the intestines. It causes malabsorption. So you're not able to absorb all the nutrition and the vitamins, and the dietitian would help the patients lead more healthy lives by giving us the information and the treatment. So you would say, okay, I've been diagnosed with celiac disease. I've seen a dietitian. I don't need to see a dietitian again. That's not true. Part of the reason is that the gluten-free diet itself is deficient in many vitamins and minerals. So who is the expert who's going to teach us so that we prevent other diseases from happening? Is the dietitian or the nutrition expert. We also know that obesity is a big, big problem in the country. And unfortunately, as children and adults start on a gluten-free diet for celiac disease, some of them do end up with obesity and other comorbid conditions. If we could see the dietitians on time, we would prevent some of the comorbid conditions. So where does the dietitian make an impact? Monitoring growth, especially in pediatrics, and advising accordingly, educating the families. You know, it's not so easy to go on a gluten-free diet. Yes, you could take away wheat, rye, and barley, but it's more than that. We've got to read the labels. We have to worry about cross-contamination, because any of those things would lead us to have other diseases in the future. The more knowledgeable the patient, the more compliant they are. The more compliant, the less the anxiety and less other conditions happening in the future. We do know that if you're not on a gluten-free diet or not on a healthy gluten-free diet, you could end up with many deficiencies like calcium, could end up with more fractures. There's effect of vitamin B12 and folate deficiency, which can link to depression and anxiety, affects growth, affects a lot of neurological deficits. So in short, a dietitian is the person that we need to treat our disease. We do know that Medicare leads the path to help provide coverage for all. And we also know that Medicaid and private insurances will follow the Medicare guidelines. So it would be really important to get the Medical Nutrition Therapy Act of 2020 forwarded. As I'm also told that both the acts that I've talked about, from the gluten in medication and the nutrition, is going to come forward again this spring, 2021, for further consideration. Finally, I'd just like to leave you some information about the contact for the Society for the Study of Celiac Disease and what the membership benefits are. It involves not just getting the news, but also education and networking for a lot of people. I would like to thank the SSCD and thank the Celiac Disease Foundation to allow me this opportunity to become an advocate and really fulfill some of the things that I miss when I'm just doing clinical practice. Thank you.